So, I'm refuting Justin's speech, and his topic was the NFL marijuana, and his proposition was the medical use of marijuana is beneficial to NFL players. His first claim is marijuana is much safer for players than other forms of medication that are actually allowed to take with no suspension. His second claim is marijuana helps players to manage the pain levels and gives them the natural pain relief. And then the third one is marijuana has neuroprotective qualities that help better protect NFL players and battling with brain injuries such as CTE. And my first claim, responding claim for his first claim is he failed to mention marijuana use is prohibited in the NFL for recreational use, and there's still an ongoing debate as to whether marijuana should be used in the NFL. I think that's a very important piece that he missed in order to strongate his previous claim. Main reason as to why there hasn't been a verdict is because the NFLPA, which is the NFL Players Association, is doing studies as to whether marijuana is beneficial to players and that are dealing with chronic pain. And it's vital to understanding why exactly marijuana is prohibited in the NFL. I feel like we can all agree that if there's something prohibited in a certain league, it's probably not best for you. And he also mentioned he forgot to mention that marijuana can have just as an effective addictive effect on a person as well, especially someone that's dealing with chronic pain. For example, in an Atlantic article, director of the National Institute on Drug Abuse, Nora Wolko, predicts that once marijuana starts to become more readily available to everyone, the marijuana dependency numbers may go up. The more pain the players experience, the more they're going to want to use marijuana and depend a lot on it. That being said, there may be a potential additional risk when it comes to marijuana use, especially in the NFL. His second claim is my response to his second claim is that I would just like to add that yes, marijuana can treat chronic pain. However, the main problem with the NFLPA are having is to regulate how marijuana is to be used, whether it's to be used recreational use or for stress coping or for chronic pain. The main assumption in this point is that marijuana should be used only for pain. However, the league has no way of regulating exactly how it should be used, whether it's appropriately or effectively. And how is the NFLPA going to determine whether it's being used effectively? My advocate states in one of his supporting claims that THC has benefits relating with pain, anxiety, and nausea. I think an important proponent with this statement that should have been mentioned is that according to the Tonic article I found, researchers at London King's College said that weed that's very high in THC is significantly more likely to induce psychosis, which is a severe mental disorder, after prolonged use of the regular stuff, which typically has a higher ratio of CBD, to THC, and THC is a compound found in marijuana. And obviously, if you are using a drug or a substance for pain, you're gonna have to use it regularly, especially like if you're in a sport. And my claim to that is basically meaning like the more you use it, the more addictive it is. Therefore, the player has a higher risk of gaining a mental disorder from it. I think this information is really important when the topic of both THC and CBD is being brought up. And then my response for his third point is that this claim is that marijuana can have players deal with their symptoms and pain easily. However, this claim needed more context in regards to statistics of CTE negatively affecting the NFL. A civilized article states that after analyzing 111 brains of deceased players whose bodies were donated for research, scientists have found that only 110 of the 111 bodies, which is 99% of it, has developed CTE. I think that could have been a really strong point to have been mentioned in that claim. I think that this information gives a better context for the advocate to have a stronger argument in which it was not even mentioned. And as a counter argument, the advocate didn't mention that for a long time the NFL refused to discuss anything in regards to CTE, especially since it's a very controversial within the league. And furthermore, I think it's important to mention that the NFL league may not even accept marijuana as something to be used as a treatment for CTE, since they didn't even want to mention it for a while when CTE was first discussed. In conclusion, I feel like most of what the advocate talked about was very effective. However, he did leave out a lot of major important components to his speech. Thank you.
All right, well, your main argument comes down to there might be a negative consequence to allowing NFL players to do this. There are several places where your argument seems like it's an evaluation more than it is a refutation of the points that are being presented, where you're suggesting that the advocate failed to provide information, and here's some of that information that would have made their argument clearer. And that's not really your obligation. Your obligation should be to demonstrate that the argument is not convincing in this particular situation. The fact that the NFL isn't particularly fond of this idea that it's largely prohibited, that seems to be the whole basis of the argument. And you suggest that the advocate failed to mention that. I think that was the whole motivation for the argument in the first place. So I'm not sure, it was unclear, although there might have been a lack of evidence on that particular point, but I don't know what that gets you. The better argument I think that you have is that the Players Association is studying this, and so that this is all under consideration. Nothing's been decided, and so this argument is perhaps a bit premature. We need additional research before we make any decision about what is desirable or undesirable. That, I think, might have been a stronger way to go on that first point. You do ask a question about why it's prohibited, and I think that you've got a good answer that you present, suggesting that there are negative consequences for use of marijuana, in particular long-term and heavy use of marijuana, and there is a link that you're presenting here that suggests, especially on the second point when it comes to the chronic pain management, that this is what would happen if people were able to use marijuana in this way, that they would become dependent on it because it'll be easier to get. It's the main source of dealing with the pain, and there are negative consequences to all of this sort of thing. So I appreciate the link between those 2 points. I think that's the strongest argument that you have on this particular issue. The stuff at the end on CTE, basically that's just a mild criticism about how complete the context was. Adding that context I don't think helps very much. I think you need some kind of argument that suggests that CTE is unlikely to be affected by marijuana use. In fact, my guess would be that if people were playing under the influence of marijuana, the chances of mistakes in the way they play would be greater, which might increase the chances of injuries that lead to CTE. I think maybe that would be the way to go on that point. All right, thank you.